Our next question is, which of the following layers are open during the fasciotomy? The option A is skin, option B, skin with the subcutaneous fascia, option C, skin, subcutaneous tissue, superficial fascia, option D, skin, subcutaneous tissue, superficial fascia, and the deep fascia. Okay, let's see the few things regarding the fasciotomy, right? Regarding the fasciotomy, first of all, you need to understand what is this procedure means. It is basically the surgical release of the all layers, including deep fascia, that is needed to be highlighted. That basically there is a release of the all the layers, but that too includes the deep fascia as well. And why we should do this? To just to decompress the muscle compartment. Okay, just to decompress the muscle compartment. So now we need to understand what are the layers that we need to take care of, or what are the layers we need to release. So your first layer is your skin. Okay, then the next layer is subcutaneous tissue. Then comes your superficial fascia, and then comes your deep fascia, right? Then comes your deep fascia. So while doing fasciotomy, one must go up to the deep fascia, or one must release the deep fascia until and unless there is no decompression of the compartment, right? So in this image you can easily able to appreciate that. So this one is your anterior compartment of the leg, right? So in case of uh, a compartment syndrome that basically involved in the anterior compartment of the leg, so we basically try to go for too long incision, right? So the manner of the incision has been explained in this image, and also in case of the posterior compartment or in case of lateral compartment, we also try to give the incision in this way. Okay, and obviously in all the cases we need to release the all layers up to the deep fascia. So one thing that you need to understand regarding the management of the compartment syndrome, like the opening all the layers, that basically ensures the compartment pressure that is adequately relieved in here. Okay, so this is our main goal while doing fasciotomy. So obviously it will eventually allow restoration of the blood flow, and that will eventually prevent from the permanent tissue damage or necrosis in that case, right? So few things regarding the compartment syndrome that is supposed to be needed to know. So regarding the compartment syndrome, it is basically a condition that basically arises due to the increased pressure that too within a closed osseofacial compartment, and that will eventually leads to impairment of the tissue perfusion. Okay, so there is increased pressure within a closed compartment, and that will eventually leads to development of the impaired tissue perfusion. So here the etiologies that you need to know is that the most common that we are able to encounter compartment syndrome typically after the fracture, and that too specifically after the tibia fracture, right? And obviously apart from there is a crash injury, there is a burn injury, also there is a few vascular injuries, or sometimes tight cast or tight dressing that may also leads to develop the compartment syndrome in that case. So regarding the pathophysiology, what is the point? How it is so important? Look, as there is a increased interstitial pressure of the compartment that basically raised, right? So as a result of that, there is a decreased capillary perfusion. So that decrease in the capillary perfusion leads to development of the subsequent ischemia, and that ischemia leads to muscle and nerve necrosis, right? Muscle and nerve necrosis. So the main clinical features, so this is the number one, and this is the earliest clinical features. So your pain that is out of proportion. Okay, so your pain out of proportion is the earliest clinical sign, and then obviously comes pallor and pulselessness. One thing that I would like to highlight is that one should not wait for development of the pulselessness. Most of the time, the pulselessness is the last symptoms that basically comes into the scenario. Also, there is a paresthesia and the paralysis is also there, right? So, your pain out of proportion is the earliest symptoms. So, regarding the diagnosis, so it's a clinical diagnosis. So, one must have the clinical suspiciousness, and while establishing the diagnosis, one need to measure the compartment pressure. And in case of the compartment pressure comes more than 30 millimeter Hg, is supposed to be a diagnostic of compartment syndrome. So you can see that in this image, right? This is how we are going to see whether there is a increased compartment pressure is there or not, right? So regarding the management, your emergency fasciotomy is the definitive way of treatment. But one thing that is that you need to understand, like in case of emergency treatment, one should not wait for around 6 to 8 hours, because your delayed decompression can leads to permanent damage, right? So then obviously there is no point of doing the fasciotomy then, right? Let's see the questions again. So your question basically asks you regarding which of the following layers are open during the fasciotomy. Look, like here they basically ask you like the what are the following layers are supposed to be open during the fasciotomy, right? So obviously by seeing the question you must able to remember that yes, that is the skin, then comes the subcutaneous tissue, then comes the superficial fascia, then comes the deep fascia. So you know the answer. Then while looking into the options, you just try to find out your answer here. Okay, do you guys able to get my point? So here obviously your answer is option D, right? Your answer is option D.